I'm Wendy Garner for Children's of Alabama. This time of year, all eyes are on the Olympic Games, and some parents have aspirations of their kids taking it to the next level in sports. Join me right now is Dr. Reed Estes, who's the Chief of Sports Medicine here at Children's of Alabama. So good to see you.
Thank you for having me.
This is an issue. We have parents who want their kids to be an Olympic athlete or maybe a college or pro athlete, and they think the way to do it is to do that sport year-round.
Most definitely. That's by far one of the most prevalent issues that we're seeing with injury, where we'll have children that are experiencing these overuse injuries. Majority of those are preventable, things that we would like to educate about and make parents aware. Particularly, we're seeing it when children are being pushed towards getting collegiate scholarships and then professional careers as well.
All right, and you've got some examples for us.
We do.
Right?
We have Cole. He's a local 15-year-old athlete. He plays predominantly baseball and football. And so we'll kind of talk through some of the potential overuse injuries in a 15-year-old. If we talk about overhead throwers, in particular with softball, baseball, but also when we consider volleyball and then some of the track sports, we can consider the stresses on the shoulder and the elbow. We have open growth plates at both of those that can be susceptible to injury, particularly from that torsional effect that we get from throwing, but also some of the muscles and tendon attachments as well as the ligament attachments that go across the front of the shoulder and across the inside of the elbow. One of the most prevalent would be little leaguer's elbow, something that's going to allow a significant pull against the bone and that ulnar collateral ligament on the inside as we go into that throwing motion.
And that can happen at any time, but that child is more at risk if they're doing that same motion all year round. Is that right?
Most definitely. We see, without a doubt, with year-round participation, early specialization, if we see multiple concomitant sports, something that's going to take that load to the next level and kind of overcome what the body's natural capability of healing is. So if we look at track athletes and we think about someone that's going to open their stride, either a sprinter or a hurdler, and we look at that back leg, we think about the tension that goes along all these hip flexors along the front. We've got two main hip flexors that attach to a bone on the top of the hip, and that can pull forcefully to allow either a fracture of that bone or some irritation of that, as well as irritation to the hip flexor itself. We think about men's and women's volleyball and men's and women's basketball as well. We can see tendinopathies or irritation within the tendon along the base of the knee as well, because of such a forceful contraction of this quad muscle as we jump that pulls against that tendon, and that's loading against just a static piece of bone. When somebody's your age or younger, they have an open growth plate there, and that makes it even more susceptible to injury. All the more reason that we need to be aware of this in youth athletes.
So what recommendations do you have for parents?
I think the biggest thing is awareness for these. There are different warning signs that we try to advise parents on looking out for, and the athletes themselves. Progressively worsening pain that's increasing with less and less activity or occurring with less and less activity. Pain that's present with a particular action. So every time I jump, this happens. Or obviously, if you have some debilitating pain, something that's requiring significant repetitive ice or anti-inflammatories and things along those lines.
What if you have a child who's doing year-round sports, but it's different sports?
And
do they still need some rest?
I think that they still need rest, but I think that's a more reasonable scenario where you have some variety in the makeup of what they're being subjected to. But I think there's still definitely needs to be a rest period to allow the muscles to recoup, allow the body to catch up with the stresses that we're putting on.
All right, some excellent tips. Thank you so much, Dr. Reed Estes, who's with the Sports Medicine Clinic here at Children's of Alabama. And for more information on this and other health and safety related topics, go to our website, childrensal.org.